Well, I appreciate being able to be with you again. And I guess I should mention that this is the last night of this series of questions. And last week we were looking at, I think it's question 19 and 20, actually, which was to do with how do we handle topics like politics and gender diversity and how to do it without being offensive. And then what should our attitude or behavior be towards transgender people? So I'm going to pick up from that and try to spend some time just touching a little bit more on transgender issues, and then look at the final three questions, which are more related to world events and the Christians' attitude towards what's going on in the world. I think when we closed last week, I made some comment about detransitioning and the fact that there is now beginning to be an awakening, you might say, among people. There's apparently thousands of people who are wanting to detransition, although officially those who are pushing this transgender ideology are trying to say that there's just a tiny, tiny fraction who ever regret the decision. But that doesn't appear to be the truth either. And so the first, excuse me, the first bit of information I'm going to just pass on to you relates to a girl named Chloe Cole, who's 18. I'm not sure exactly when this interview was done. It's probably a couple of years ago, maybe, or no, maybe it might have been the beginning of this year, who began to transition when she was just 12 years old. And so I'm going to get into that. But there's one verse that I'm going to give first of all. That's in John chapter 8, when it speaks about Jesus speaking to people, and some believed on him. And said, then said Jesus to those Jews who believed on him, if you continue in my word, then are you my disciples indeed, and you shall know the truth, and the truth shall make you free. I think that's an important principle for us. It's typical for us as Christians to try to just get along with people and not cause offense, and to try to be compassionate towards people, which is all extremely important and valuable. But at the same time, we have to be truthful with people, and to the best of our ability to, if we can, introduce them to what is true about such an important and life-changing aspect as transgender issues. And I think I did mention last week as well that in the United Kingdom, there was a landmark court case against a clinic performing these gender-affirming treatments, and the complainant who claimed that she was a young girl and not able to make an informed decision and agreement to it and so on, and now regrets it and claiming many damages because of it. She actually won her court case, and this has triggered a flood of them. I think there's apparently over 1,000 of court cases in the UK alone against that clinic. And I believe Sweden, and it might be Denmark and Finland, have actually halted this program. So that gives some encouragement that the tide might be shifting at least somewhat. So anyway, I'm just going to, again, give a bit of information from this YouTube video that I watched. It's called Detransition, The Wounds That Won't Heal. And it's an interview with Chloe Cole with analysis by Dr. Jordan Peterson. And so just a bit of information about her. Chloe Cole is an 18-year-old detransitioner from the Central Valley of California. She started her transition at 12 years old, was put on puberty blockers and testosterone at 13, and had a double mastectomy at 15 years old. But she is now a strong advocate against gender ideology. I found it quite a powerful presentation. And I guess some of the information that I found helpful in it, I believe would be useful to anyone who's struggling. If there's anyone that you know of or anyone you hear about and that is struggling with this kind of an issue, it would be very helpful to listen to this interview, because there's a lot of detail given of her feelings as a young child. Because as a young child, she was a little bit autistic, but she was very intelligent. And so the doctors didn't really pick up on her autism. And apparently, for whatever reason, girls with autism are more prone to this gender dysphoria, which they more incline towards male inclinations. And so she was a bit of a tomboy. And it's interesting how one of the basic distinctions that are not ironclad by any means, but boys tend to be more interested in things. Girls tend to be more interested in people. And so there's of course a spectrum on that. But so when she was getting into puberty, and apparently she was becoming puberty was happening earlier than usual for her, it just increased this tension that she had within herself and her discomfort with who she was. And so she started seeing these things on TikTok and so on. Instagram, was it Instagram or TikTok? I think it was Instagram maybe. And so when she first began this therapy of puberty blockers and testosterone, she actually felt more positive and happy. And she was thinking that she was, going to be able to now be what she wanted to be. And that she could be a boy now instead of having all these vulnerabilities of a girl that she was struggling with. However, she very quickly recognized that she was conflicted both sexually and romantically, because she was still more attracted to boys than to girls. And then as this progressed, as she was going through the teen years and, seeing other girls and boys dating and that kind of thing, and she just realized she was caught on this dilemma. And she realized that whether she dated a boy or a girl, she was in kind of an unworkable situation. And finally, when she had her mastectomy at age of 15, which she thought would resolve her problems and let her, be more openly a boy and so on, it wasn't very long after that she began to have doubts. And about 11 months later, she finally broke down and revealed to a friend and to her parents that she regretted transitioning, and that she wanted to now fulfill her adult life as a woman. But what was interesting is that what really triggered this change in her was she was in a class, and I'm not sure if they call it a sociology class or a psychology class. It was about the development of children. And she was learning for the first time about this very precious and beautiful relationship between a mother and a child, and how important the mother was to the child's development. And that just triggered something within her as to who she really was and who she really is, and what her desires are. Now, fortunately for her, when she did, stop her testosterone treatments, she was able to resume having her period. So there is hope for her that she could be fertile as a woman and be able to have children now, which she desires. But of course, sadly, there's things that can never be reversed. And it's not for certain that she can ever have children. And of course, the breast removal surgery has left her with actually physical ongoing problems that have not ceased even now. So she is actually mounting a legal claim against those individuals and institutions who took her that route. And so possibly the beginning of that kind of challenge to this whole transgender movement. Now, you've probably heard the name Matt Walsh. He put together a documentary which was basically made up of interviews with people involved in the transgender movement. And he had this one simple question: what is a woman? And it seems like such a simple question, but it's just amazing when you watch some of these clips of this documentary, how whether it's an activist or whether it's a doctor, they cannot answer that question coherently. They want to make the claim that it's anybody who identifies as a woman, but you can't use the same term to explain the term. That's called circular reasoning, and they're forced into this, and they just over and over again are just brought to confusion and silence, and it's a bit provocative and controversial, you might say. I mean, controversial, kind of confrontational, I should say, really. But anyway, it would be worth watching it. I would, yes. But one I wanted to point out is another one. That's another interview that Dr. Jordan Peterson made with a woman called Sarah Stockton. And it's called The Regrets of a Trans Care Specialist. Now, what I found particularly interesting and significant about this is that she was involved in some of the very earliest formulating not only the doctrine of it, but actually the letters, the mandates, and so on that were instituted in various hospitals. And so, just a bit of information that's given on to do with that YouTube video as well. Sarah Stockton is a licensed marriage and family therapist, lecturer, researcher, presenter, and clinical supervisor of a psychotherapy group practice in central New York. In 2012, she co-authored and published one of the first mental health assessments that were utilized to assess youth's readiness to begin medical treatment for gender transition. And she spent the first part of her career as a clinician treating and advocating on behalf of youth and families surrounding issues with gender. And so she was actually at the forefront of this whole movement, you might say, in the United States. And so she taught medical facilities, physicians, and schools how to provide what we now refer to as gender-confirming care. So she wrote many of the first letters that were used to approve gender transition surgeries on minors. However, as this was all going on, it says, due to many concerns with the treatment outcomes and how this ideology was being presented to children, she shifted her focus away from working primarily with this population. Now, I believe that she was interviewed by Matt Walsh in that documentary. And so she has changed her stance from being a proponent of it to being someone who is now opposing it. And so I found that quite significant. And these are important pieces of information, that because we're all stuck with this reality that we're not specialists. We don't have the authoritative voice to discuss some of these issues. But when you can pick up testimonies from people who have been involved in it very deeply, and the very forefront of it is fairly powerful. And so it says, since appearing in that documentary, Sarah has received constant emails and calls from medical professionals across the globe sharing their fears about speaking out and the lack of conversation around this serious topic. So this gets back to this primary issue that we have to know the truth about something. We have to, in compassion and care, give them the truth. And so I've just, excuse me, put together about 2 or 3 other questions that I've thought of that just relate to all of this. How to handle a family member who transitions. And this is very similar to someone who, as the expression would be, who comes out as gay. A very similar kind of trauma in the family. The first thing as a family member is that we need to reaffirm our love and care to that person. But we also need to be very, very patient in the hope that, if not now or in the immediate future, that someday they will want to return to what is right, what they know is correct. Seek to genuinely listen to them, try to draw them out to understand their thinking, to get some insight on the struggles that they're going through, because the struggles could be a lot more complicated than just simply that they think they need to change their body. And to caution and advise if it's possible. And I would say some of these sources that I have just referred to here could be extremely helpful to give them the information they need that would help them to counter these false concepts that they've been fed. Of course, even better than that is prevention. And I think we owe it to ourselves, we owe it to those that we love to educate them ahead of time so that they're inoculated against these false concepts and the consequences of the choices, because there's tremendous consequences that are possible. It's kind of funny, after I was thinking about this recently, I remembered that back in Timmins, there was actually a Christian couple who associated with us for a while, who had a situation like this, where they actually had a baby that would probably be called today a hermaphrodite, because this baby did not have definite, female or male genitalia when they were born. And so they decided to make her a girl. And as when we knew her growing up, she was just this little girl growing up. Now, unfortunately, this couple left associating with us, and they sort of went off on their own, got involved with another group. But we learned later that in teen years, this girl rejected her female gender and chose to transition to male. I don't know if they would have done DNA testing on her, whether they could have known whether it was, actually a male rather than a female. And I don't know the end of that story at all. But it is kind of strange when you think back that you have been exposed to somewhat similar situations. So the next question is how to handle a transgender person who attends an assembly meeting. We need to be gracious to them, kind to them as an individual, and evangelize them, speak to them in the gospel as you would any other person who needs salvation. If it's a man presenting as a woman, and you know that this is what the situation is, there's one or two things you do need to be protective about, and that is you need to protect those who are women in the congregation. And access to a woman's bathroom and things like that would be issues. And I believe it's right and fair to communicate that very directly to the individual involved. Now, a few years ago here in Sudbury, there was a Christian employer from another city who happened to be doing some contract work in Sudbury just when we were having gospel meetings. And he invited his employee out to our gospel tent meetings. But he called me and gave me a confidential phone call to warn me that this employee had transitioned from male to female sometime previous to this, and that he would be in significant legal trouble if if it was known that he had exposed this private information. But he felt that he owed it to me, to at least warn me, to try to keep it as, confidential as possible. And so, this person came out, and when I looked at this individual, obviously she, presented as a woman and so on, but it to me like a person who had a lot of problems. And so it was just, came and went. But the next time he brought this person, it was at the hall. And on that occasion, there was a sister in the assembly, and also a brother in the assembly who was extremely a real go-getter as far as he would buttonhole anybody who showed up at the door. and evangelize people. And so, trying to, invite this person out for coffee and get the phone number and so on. And when the Christian employer saw this happening, he panicked, and he decided not to bring this person out anymore, and just to, witness to the person individually. And so that's the closest that I've come to this exact situation myself. But it does, certainly for us as Christians and Christians in Assembly Fellowship, it certainly triggers some very serious considerations for us. What about trans people in relationships? Is there any category or combination of marriage that we could acknowledge? And it's a real brain teaser as to what would you ever do? And then what responsibility would you have to inform or to warn any prospective partner as a professing Christian? These are things that are, they're terrible to have to contemplate. Could you ever baptize such a person? Could you receive them into fellowship as a trans person? Under what restrictions? These are things that we should think about and have some kind of sense in our own minds as to where we're at with that. I was reminded Jude, verse 22 and 23, where it says, "And of some have compassion, making a difference, and others save with fear, pulling them out of the fire, hating even the garment spotted by the flesh." Now, I'm aware that just because someone has gender dysphoria and chooses to transition to what they think is the opposite gender or another gender, or again, I haven't even gotten into the issue that today there's believed to be, promoted to be this almost infinite range of genders. Some talk about there being 41 genders and whatever. What do you do with that? It's just a mental confusion. So it does trigger a lot of, serious things for us to think about as believers. And so I feel personally that I'm still doing more exploratory thinking in my own mind on this. So I don't want to venture any more opinions. Certainly not any firm declarations on issues, and just pray that we're preserved in our families and that we can be a help to people who may have gone through some of this.